There we go. Put that right on top. Perfect fit. All right, have a good one, okay? When people hug me and say, I didn't have enough food to feed my family this week, that is so rewarding. And especially if you're in Garfield Park, having access to healthy food options are important for our patient population, especially those that are in food deserts. It warms my heart. It makes me feel so good that we are able to do something as a hospital to provide to this community. The most important aspect of my work is really all of it, and it really folds into one another. So I first joined Rush in February of 2006. I wear a number of hats here at Rush. The first one being spearheading the Community Health Needs Assessment and Community Health Implementation Plan. The CHNA is kind of like what the resources are. I also oversee our Food is Medicine program and then our Employee Volunteer program. But we also have an opportunity to see what type of resources we can kind of include in the community based on what we're doing as a hospital institution. We can finally serve Garfield Park. Our typical food distribution is fairly easy to put on. We have to have a community partner who's willing to work with us. We already have a commitment and a partnership with Top Box Foods. And then we put out a call for volunteers. And typically we get about 20 to 25 volunteers that are inclusive of some of our students here, mostly our medical students that want to get involved. Different communities need different resources. And so as a hospital institution, we are able to listen to those needs and really address them through what a community health implementation plan is. We are partnering with a community-based organization or a church, and we typically are able to put that distribution on within a couple days. Typically the food goes pretty fast. The most rewarding piece of doing a food distribution is being able to see happy people walk away with food that they need for their family. We usually give away food that'll last a family for a week and a half, and so we're talking chicken and tilapia and ground beef and turkey, and then a box full of produce. Rush is definitely a leader in that space, and they really care about my work. It's very, very evident what I'm really passionate about. I'm really passionate about the Food is Medicine work. Obviously, I get a chance to feed people who are really hungry, whether it's one community at a time or all of our catchment areas at a time. So I'm really excited about this work and love it so much. Thank you so much for being patient. Really appreciate it. That was really sweet, okay.